This is our COVID-19 update for May 26. We have had 11 new people test positive for COVID-19 in BC today, bringing our total to 2,541. That includes 897 people in Vancouver Coastal Health, 1,261 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 194 people in the Interior Health Region, and 62 people in Northern Health. We have no new healthcare facility outbreaks right now, and we're really pleased to say that the Richmond Hospital outbreak has now been declared over. So that leaves us with 15 active outbreaks in our healthcare system, 14 in long-term care and 1 in acute care. And also on a positive note, we've not had any new resident cases in those outbreaks in the last day, on just a single increase in a staff case. Bringing our total to 543 people in the healthcare system. You will note that that is actually 2 more individuals than 210 staff people, and that was a data correction, but it was previous cases, so not new cases. We also have no new community outbreaks and are continuing to monitor and to support the number of community outbreaks that we have ongoing in the community now. So that leaves us with 258 active cases right now. Of those, 37 people are in hospital and 7 of those are in critical care or ICU. And I'm extremely pleased that today, for the first time in a while, we've had no new deaths from COVID-19 in British Columbia. And we've had 2,122 people who have tested positive who are now fully recovered. So that is good news for us. We have a few more days left. The survey that we have been to gather your feedback about your experiences of the past few weeks and help direct our responses going forward. So it's Your Story, Our Future study. Over 321,000 people have taken it so far, but we do want to hear from people, particularly people in the north, people in smaller communities, and elderly people. And if there's people out there who don't have access to technology, please assist them in helping to complete that survey. I know now that we are in phase 2, there is a lot to look forward to, and slowly and thoughtfully we are increasing our activities. And I understand that with this transition, there comes a lot of anxiety and some uncertainty and some frustration. And for some, that means frustration that we are moving too slowly, and for others, frustration that we are moving too fast. It is a balance, and I know that is very hard to achieve. And it has been a learning experience for all of us in the past week, trying to find that right balance. Today we were able to report, as I said, no new deaths for the first time in quite a few weeks. And we want to be able to do this every day, so no more families have to deal with the loss of somebody they love. So I encourage everybody to continue to show patience and understanding and have confidence that what we are doing is the best that we can to protect our families and our communities. And that means that it might be slower than many people want, and it might be faster than others. We know as well that COVID-19 is in all of our communities, and we've talked about the people who have tested positive, but there are also the close contacts that we continue to monitor in public health. And right now our focus is on that. It's on ensuring that every case that arises in our community, we can follow, we can test, we can trace the people they've been in contact with, and we can track those people over the period of the incubation period to make sure that if they do develop symptoms, they have access to the health care they need. And for those who are sick, we do monitor as well every single day to make sure that they have what they need and are able to access healthcare services safely if they need them. From what we have learned and what we continue to learn about this virus, the measures we have in place are the best things we can do to slow the spread. That's why we are trying to have a series of measures that work in our community that we can sustain over time. Everyone in BC has put in the effort over the past number of weeks and months now to flatten our curve, to keep it as low as we can get. And we're now 1 week into phase 2 with more people out, more businesses open. We cannot go back to our pre-COVID days. We need to find that balance that allows us to get things moving, to have increased contact, social contact and social connection, but not to go back to the place where this virus can take off and infect a large number of people in a short period of time. As we slowly make this transition, we can spend more time with others. We may see an increase in cases, and that is what we in public health are preparing for, and why we are making some of the restrictions that we have in place around numbers of people that can gather, around the importance of making sure that if we are ill, we stay home, around the importance of maintaining our safe physical distance from each other, the importance of our continuing adherence to hand hygiene, and in some situations, adding that extra layer of wearing a non-medical mask. Small numbers and knowing who you are with helps us make sure that we can continue that public health activity to keep our communities safe. As we go forward, our new normal is different, and it will be for some time, and we need to keep within our limits and keep up what we know works. We all have a role to play, and we've seen that that can be successful here in BC, and it relies on our ongoing shared commitment and effort. Remember what I've been saying, the bigger spaces and fewer faces. That helps us all, and it keeps us all safe. But also remember to show that compassion and care that we have for each other as we're going through the anxieties of this transition. Continue to be kind and to be calm and to be safe.
We're obviously pleased that there are no deaths to report today and only 11 new cases of COVID-19 in BC. So 37 continue to be in hospital and 7 in critical care. And note that about 69%, our occupancy rate is up to about 69% in BC hospitals across the board, still around 50% in critical care, and that yesterday 5,234 people visited emergency rooms across the province, which is one of our higher totals since March. And I see that generally as a good sign. Every Tuesday I've reported on PPE that we've received over the last week. I just want to recap where we've been cumulatively from the previous announcements since the beginning of April. We've obtained approximately 4 million N95 respirators. 63,700 of these are from the federal government's bulk procurement. That's 1.6%. Approximately 4,250,000 surgical masks. 146,800 of these are from the federal government's bulk procurement. That's 3.4%. Over 1,250,000 pieces of eye protection, including goggles and face shields. 381,000 of these face shields are from the federal government's bulk procurement. That's 30.53%. Approximately 26 million pairs of gloves. 440,000 of these are from the federal government's bulk procurement, or 1.7%, and approximately 1.3 million gowns. Today, I can tell you that we've received since last Tuesday 151,772 additional N95 respirators, 255,600 surgical masks, 1,380,700 pairs of gloves, 7,405 pieces of eye protection, and 233,250 gowns. As always, any product that we receive that isn't from a previous trusted vendor will be subject to assessment and testing before it gets into the health system. This includes masks and respirators received from the federal government and from donations as well. On the topic of PPE testing, I'd also like to mention that we've recently received a new machine that will be able to use to test masks and respirators right here in BC. The machine, called the TS18310A, is used by leading filter manufacturers and test centers around the world. It will be used here in BC to test the filter efficiency and function of respiratory masks and compute results so we can ensure that any masks and respirators that we procure from new international manufacturers are in fact safe and effective from a filtration perspective. And we're obviously very appreciative to add this to our efforts. to secure PPE and to put it into use in BC. In closing, I wanted to go back to a point that Dr. Henry has made repeatedly and effectively over the many months that all of us have been meeting up most afternoons through COVID-19 updates. BC's COVID-19 response is just that. It's our response. It's our Made in BC response to keep us safe in a global pandemic, in our own pandemic that we're dealing with in BC. It's a response that saw British Columbia come early to its fight. It's a response which, through our effort and skill and even some early good luck, saw us bend the curve and not the rules to get us where we are today. It's a response that saw all of us, each one of us, make a difference and build our own future. The past few days have offered some images from other jurisdictions where efforts to stop the spread appear to have paused in some places, where the sacrifices made to keep people safe appear for the moment to be forgotten. Each of us can see these images, and in thinking about BC and how much longer for further easing of restrictions, momentarily wonder, why bother? Why keep using the skills we've learned to stop the spread when these images can make it seem like others have drifted? But I'd ask everyone who may have had this thought not to give in to it. I'd ask everyone to remember the things that should give us strength and the confidence to keep doing what we're doing, to build a future, to build our future in our BC COVID-19 effort. I'd ask everyone to remember that not all jurisdictions started their pandemic fight as early as BC did, but by staying 100% committed to our effort and by remaining 100% all in our BC COVID-19 response, we find ourselves choosing social, surgical, and economic renewal, not being forced into it. While we watch how others manage their pandemic response, the lead to follow right now is our own. The shortest distance between where we are in BC and where we all want to be is to follow the guidelines Dr. Henry has provided, using the skills she and other people in public health have taught us by staying apart and working together. This is our BC pandemic, our BC effort, and our BC path to safety. The lead to follow is ours, and we continue to look to each other and count on each other for the leadership that has brought us together and taken us this far.